right, everybody, thank you for being here. Thank you for joining. Got an amazing guest tonight and got amazing people on the call too that are joining us. I'm Darin Scott, so I'm a filmmaker, and 2 months ago, I didn't know about Lifewave, and I had an actor in my movie, Eugene Brave Rock, who made a post about stem cell activation technology, and that is something that perked my interest because I had seen my mom and my dad go through stem cell therapy, the kind that they inject and that costs like $6,000 and stuff. And I saw the miraculous recovery. And so stem cells was something on my mind. And so when I saw that with Eugene, I was like, whoa. So I call up Eugene. He's got a stunt background. He started in stunts. And so he's got a lot of pain issues. And I knew that. So I'm like, hey, Eugene, what's going on? And so he told me about it. And it's just this little patch, just like this. It comes in this sleeve. Today, we're going to talk about X39, okay? It looks like a sticker. I'll show you the back because I want you to have some context about what we're talking about tonight. It's just this activated part on the back, and you stick this on your body. The idea, everyone, is that our bodies emit light, infrared light, heat. And these patches emit a specific wavelength of light back to our bodies. And that little bit of energy that's returned to the body, your body does miraculous things with it. So before we get going, I just want to share my screen real quick. Lifewave products are based on the theory of phototherapy. We're not your doctor. We're not telling you that you're going to cure any diseases. You're going to hear some awesome stories tonight. And you can't take away people's experiences that they're having with the product. And that's what we invite you to do, is try it for yourself. Because until you do, you'll be like me. I was a filmmaker. I didn't know anything about this. And I put it on for myself. My recovery after the gym got cut in half. After I started using these, I don't get sore anymore after the gym. I've had multiple opportunities to test it. I've got a mental clarity that I've never had in my life. I really am captive to this company and to the community of amazing people that brought me in. For everyone who wants to know more about this is my website, bodylightheals.com, where you can watch my 4-minute story. And if you navigate over here, guess what? I have finished migrating all of the clinical studies that are published on the website, lifewave.com. They're no longer on the USA site, so I did this so that they're available. And you can go here, you can click on any study, and you can see the results. Look at that. Over 100 clinical studies. This is 80 of them here on my site. You can check it out, bodylightheals.com. Dr. Adam Scheiner is a renowned laser, eyelid, and facial plastic surgeon. He has been featured as a health expert on Dr. Oz, Doctor's TV show, Howard Stern, the New York Post, as well as on local and national affiliates of Fox, CBS, ABC, and NBC. Dr. Scheiner has perfected a treatment for festoons, one of the most pervasive and often incorrectly treated forms of eyelid bags. Dr. Scheiner treats patients from around the globe with his Reset festoon laser treatment, and it's really amazing. He's going to show you some before and afters tonight that are going to blow your mind. Dr. Scheiner has received his medical degree from University of Pennsylvania and completed his internship at St. Barnabas Medical Center. Dr. Scheiner's Wall Street Journal and USA Today bestseller book, The True Definition of Beauty. It looks like this, folks. This is his book. He'll talk a little bit about it. This will embarrass Dr. Scheiner, but I'm going to do it anyway. This, everyone, is Dr. Scheiner. This is who we're talking about. So without further ado, there he is, the man himself.
Hey, Darin. Thanks for that little intro. I really appreciate that. Hi, everybody out there. I'm on the East Coast. We got a lot of people in California tuning in. I enjoy talking about the science of this.
Well, just real quick, I found his talk on YouTube, and I was blown away. And I reached out to Dr. Scheiner, and he said, hey, I'm good to come on. So I'm so glad that you came on. Thank you so much for your time and coming on and sharing your amazing knowledge and stuff. So yeah, take it away, man.
My pleasure. Yeah, Darin reached out to me because I've given talks for Lifewave places like this, and I've done a meeting here in Tampa where I spoke to about 1,500 people about the science and how this works. First of all, I want to thank Darin for inviting me on your podcast. And we're going to talk about my practice, and then why in the world would a doctor get involved with using these patches? But I want to talk about how it helped my patients. So yeah, my background, I think it's good to know where people come from. I come from the Northeast originally. I went to school at University of Pennsylvania, did my fellowship out in Oklahoma City. I've been in private practice now about 24 years. I do have a book on Amazon called The True Definition of Beauty. It talks about how when we see each other, what are our subconscious brain seeing? There's this language that goes underneath our conversations, and I kind of pull the covers over that so we can understand that more. I was featured on Dr. Oz. That was me treating an avocado. It looked so much better after I was done with it. That was a very attractive looking avocado afterwards. These things that form on the cheek, they're known as festoons. They've been a problematic condition for people, for my fellow colleagues too. So I have ways of using lasers actually to help tighten the skin there. I was actually featured on the doctor's TV show. It's funny, both these shows are off the air now, but this is Erin, and same thing that she had. She had those festoons, those swollen pads on the lid that makes them look kind of tired when they're not tired, and I was able to help her too. I have an international practice, people coming from all over the place. I have a patient in from New Zealand right now, from New York, two from Washington and Oregon right now, but I help everybody. Everyone comes in to see me. I want to thank John Harmon. He's a chiropractor that I borrowed these slides from. He has this book called How to Reverse Aging, and I want to give a shout out to him and because he helped me with this presentation. X39 photobiomodulation patch. So how does this work? Well, this initially came about by some research that was done by Caitlin Connor, David Yu, Jens Eickhoff, Susan Wagner, and Amy Chang. It was published in 2021 in Internal Medicine Research, and it was actually a double-blind test. What that means, it's more of a scientific rigor when something is double-blind. So this means that they randomized it to really show more statistical sensitivity and real statistical significance to this study. People who wore the patch, people who didn't wear the patch, and looked at their copper peptide levels during this process over about a week or so. This was randomized control, exposed the impact of wearing the patch initially, and then over about a week. It's interesting, it was actually so revolutionary, they actually presented this to the US Patent Office to receive a patent for the X39 technology. It was pretty amazing. They had these two randomized groups. They saw a significant increase in the GHK or copper peptide when compared to the control group. They took initial blood and they took more blood about 7 days later. We're going to get into this, but what this study said was that the patch was able to increase copper peptide. Now I want to talk about what is copper peptide? What does this mean for us? So this was actually first isolated by Dr. Lauren Picard in 1973. I think that Lauren should probably get a Nobel Prize, for this at some point because it's so revolutionary. It belongs to a group of emergency response molecules that are released during injury, sent to any injured tissue. And it's been shown to have a therapeutic role in age-related neurodegeneration and cognitive decline. And it actually increases axon survival and maintenance of nerves. So some of the actions, it activates stem cells, so it's wound healing. It's beneficial for the hair, skin, and nails. It's antioxidant, anti-inflammatory. Who out there couldn't use some anti-inflammation? I can. You guys? Yeah, I think we all could. It beneficially alters the expression of human genes. We have genes that are good for us, genes that code for good things. For neuron function, it turns them on to express that, so we have better neuron function if you have higher copper peptide in the body. It induces strong anti-anxiety, anti-aggression, and anti-pain within just a couple minutes. And I'm going to talk about that. It's really interesting. Within about 10 minutes of putting this on, it's anti-inflammatory throughout the whole body. It's kind of amazing. I'll talk about that. This is sort of a complicated thing. It says alleviated neural apoptosis and intercerebral hemorrhage. When you have a hemorrhage in the brain, the pressure causes the nerves to die. That's apoptosis. And what they found, if someone did have an intercerebral hemorrhage and they had high levels of copper peptide, their nerves did not die. So this is kind of amazing. It's actually reset, as I was talking before, about 4,200 genes to a younger, healthier state. And it's the number one biologic active compound that's recommended for chronic obstructive pulmonary disease. In programmed cell death in several types of cancer. So it resets the death cycle so that those cells will actually die. We can't make any claims to this, but in cancer cells, you have a cell in the middle, you have a cell on your left, on your right, above you, below you. That sort of package of other cells usually tells that center cell, okay, don't grow too much. Now, in cancer cells, they ignore those other cells. They start growing. This kind of resets them so that they will die at times. And it's not been shown to really cause any side effects when we increase copper peptide. When people have had damage in their spinal segments in their neck, they've actually injected this around there and had an increased amount of healing in spinal segments in the neck. Enhanced activity of alginate hydrogels for human cord blood. A hydrogel is sort of a patch that can be put on a bone. And when they put in, they increased copper peptide in, then it helped with bone growth. That's what it's trying to say there. And it heals many things in terms of the skin, stomach, intestine. Your strongly attracted capillary cells, okay? So if you have high copper peptide, it says, come here, bring your vessels, bring your healing cells to this area. And it activates genes, something called the ubiquitin protease system for cell cleaning. So this is a system that we have in our body that cleans out the cellular debris, and it activates genes. When you have high copper peptide, it activates the genes that will actually increase cellular cleaning. And that's something I could use that. I think we could all use, right, Darin? You could use that?
Absolutely.
When you give someone steroids, it slows down healing and rejuvenation. But that's good in certain cases, like you want to give people steroids to reduce inflammation, but you don't want to slow down the healing. Well, if somehow, I'm not saying how, but if somehow someone could find a way to increase copper peptide, it would actually block that anti-regeneration effect. Cardiovascular disease is one of the biggest killers in our country and many countries in the world, and having high levels of fibrinogen is a top predictor. So if you have a lot of copper peptide, it actually reduces the ability to make that fibrinogen, which is amazing. Myostatin increases its gene expression, and that inhibits heart failure. If you go into PubMed, which is sort of a repository, you can all with this, pubmed.gov, there are 124 papers about all the things that copper peptide does. It does a myriad of different things. And you can find a lot of things I was just talking about there. And this is one. So the copper peptide lysosomes to wound healing, okay, they increase the copper peptide and put this on wound healing in mice, and they saw more healing. This was interesting, the effect of, there's something called neurofiber NFB, which has to do with cancer cells, and this will actually suppress those molecules that have to do with cancer cells. Going back to the study, they saw a significant increase in the blood in the active group, the people using the patches, compared to the controls. So this was actually statistically significant. So what happens when you put it on the skin? Well, we are known to work with light. One thing that we need in our life is vitamin D. It's very important for our health. And we go in the sun, the UVB rays will pass through our skin and will actually work on this synthesis process where we can take 7-dehydrocholesterol and turn to vitamin D3. So we know how to work with light. Copper peptide helps with wrinkles, loose skin. It's used for metastatic colon cancer. I talked about the programmed cell death, DNA damage. COPD protects his lung cells. Superoxide dismutase, one activity that has to do with a lot of diseases, and it can suppress that. In terms of nerve function, it actually can increase nerve function. I'm going to show you this. Anti-anxiety, I'll talk about that too. Anti-pain within 12 minutes. So there's a patent on this. We're looking at the fact that we found this molecule. Lauren Picard was the first one who found it, copper peptide. It increases wound healing and resets genes to a younger state. Traditionally, it was placed on sort of those acupuncture areas, the back of the neck or underneath the belly button. It can be used anywhere, that'll tell you. The stem cells know where to go. So if you want to put it in your hand, on your ear, wherever you want to go, it works everywhere. But, if you want to be more with the studies, they were doing in these areas. So a lot of people tend to put it in those areas. You can put it for an area of pain. It's activated by the body heat. It takes our infrared energy, which is heat energy that we have. We can't see infrared energy with our own eyes. There are ways we can actually see with detectors, we can see infrared energy, but it goes out actually a couple meters. I put out a lot of heat. I tend to put out generally. My wife likes to snuggle next to me because I put a lot of heat out. That's the infrared energy that we put out. It's kind of interesting that why were we made to put out infrared energy? It's actually wasted energy to a certain degree. We're putting it out into the universe. Anyway, what this does, this small patch, it takes it and it's filled with nanoparticle crystals that reflect that infrared energy back on the body. And when it gets back on the body, it causes an increase in copper peptide. And I was saying about all the amazing things that copper peptide does. So if we could find a way somehow, maybe someone in the audience knows how we can increase copper peptide, right? These patches do it, right? But if we could, it has a myriad of different effects. This is photobiomodulation. This is interesting. They actually did this in Japan. They were looking in a very, very dark room. And it turns out that we glow. We're these souls in our body. And then we give out light in a very, very dark environment. They were able to show that. So benefits, it's anti-inflammatory. It increases stem cells. Immediately, there's antioxidation, decreased inflammation. I'm going to talk about that. New energy. People find less tired. People are sleeping better. Sometimes remember their dreams more when they wake up. Pain relief is something that we see. I'm going to put in this little text thread. This was a colleague of mine. He's a surgeon up in Philadelphia. His name's Alan. And Alan was having some problems with my wrist. I'm going to have carpal tunnel surgery. And I said, Alan, let me send these patches to you. We just learned about it. And these patches might be able to heal you faster from that surgery. Well, he didn't tell me, but he was having problems with his back. And in fact, his back was bothering him so much that he actually had steroids injected into his back earlier that week. So I sent it to him. We were talking on a Sunday. I sent it to him, got to him on a Wednesday night. He got steroids injected in his back on a Monday. So he got it Wednesday night. He put it first on Thursday. Thursday morning, he put it on. And he said, I said, how'd it go? You know, he said, Adam, weird, but yes, I've been having a lot of back pain. Pretty sure they need a laminectomy. I had an epidural last week that failed. I woke up this morning and read online was the soonest an epidural could be repeated. The patch went on around 7:15. The nurses never saw me jumping so much. They actually commented on it. My back feels about 75% better already. I don't understand it. He goes on to say, I never want to take it off. I said, Alan, you do have to take it off. It's 12 hours on, 12 hours off. Okay, to go back to that, the stem cells are not rushing to the wound in like 3 hours, okay? But that's the anti-inflammatory part that I was telling you. About 10 minutes after putting on the patch, it's anti-inflammatory on the whole body. And that's what happened with him. It reduced the inflammation around those nerves coming out of his spine. And that's where his pain relief came from. Flash forward now, he's been using it now about a year. He actually canceled his neurosurgery appointment now because his back is doing so well. And this is a fellow surgeon of mine. Wow. Wrinkle reduction. This is interesting. This is Maddie, and this is showing her after about a year of using this that her skin got better, and that can happen too. They have one, we're talking about X39. There are other patches there like Alvita that help the skin also. Force performance. They're finding that people can respond to injuries faster when they have a lot of copper peptide. Hair growth. This was amazing. Let me show you this. This is someone from 6 weeks after. Look at the hair growth that he had over about 6 weeks. Kind of amazing. Skin rejuvenation showing here. This person on the right, he fell through rafters and he was doing some repairs, fell through the ceiling, broke 6 ribs, punctured his lung. They expect to take 6 weeks. He was back to work in 3 weeks because he was using the patches and because he increased the copper peptide in his body. Look at the fingers with the wound repair there on a 6-year-old, how with the patches it helped things heal. This woman who had radiation treatment with the patches, her face healed faster. Our brains, we have different levels of brain activity. There could be ones that are too slow, they're too active. We want to be kind of in the middle. And they found that when they tested brain function, that people who had a high level of copper peptide actually had a more even keel to their brain activity, which is kind of amazing. Scar improvement. This was a person, he had open heart. This was part of the scar. And you could see July 2018, a month later, see how much it filled in. Kind of amazing. This was just using it for about a month or so. Same thing here. You could see September to October, just about a month. Look at how better healed it is there. So wound healing. This one I want to talk about here in a moment. Surgical scars. This was 2 weeks after, kind of fast. So this is probably a little bit of anti-inflammation that reduces that, but some stem cells too. So how in the world did I start using this for my practice? I'm a surgeon. Like, what in the world, And so I use laser technology, and I can drastically improve the appearance of aged skin to a younger, healthier, more attractive skin. However, the initial healing usually takes about 10 to 14 days and a few months for full recovery. And that's something that I've been in practice now about 25 years. So I started using it because I've been researching ways to speed up healing for my patients. This is what I do. I call it reset skin. I can take someone's skin. I can actually use the laser, remove the top layers of the skin, and then the body heals the skin all over again, and they get new skin. So we get kind of amazing effects this way. Here as well, you can see how the spots are improved. The collagen fills in too. We do this for women. We do it for men too.
It's amazing.
You see the lower lid skin there? It looks like the same person, but the younger version of this. This looks like the younger brother and the older brother.
It looks like CGI.
Yeah, exactly, right? Exactly. See the spots in the temple area near the hairline? See those spots are better. And then he just looks like a younger version of him, And people say to me, oh, is there some cream you could put on that can get rid of this kind of damage? There's not. But with the reset procedure that we do, we reset skin back to a younger, healthier, more attractive state here. It's another one like that. You can see how just brand new skin that starts over. So this was really my why. So if patients take a long time to heal, I've been trying to find ways to speed up healing for people.
Yeah, it looks like a Barbie.
She's just, I think, about 3 or 4 weeks, and she was using the X39 patches, by the way.
This was 3 weeks after?
Yeah.
Whoa.
Get back, hold on.
That's crazy.
Okay, so I have done a lot of studies over time. I looked at all these different types of products, amniotic stem cells from a place in Santa Monica called Skyworth Biologics. They were taking banked amniotic fluid from women who were going to deliver after they tested them for diseases, and they were spitting down the amniotic stem cells and they were injecting it into bone wounds. And then we used it on the face too. And that absolutely worked. It was expensive though. It was thousands of dollars. Hyperbaric oxygen, that is actually sped up healing too. That has a certain cost to it. And now the new thing is the X39 stem cell activity patches. I'm going to show you how this works now. So just pay attention here if you can watch this. I want to say once again, Lifewave is not to treat specific diseases, okay? I'm giving you my experience. It's not really made to treat any specific condition. We're just giving stories about how it has helped my patients and other patients. These are 3 patients who had this reset procedure with me. 2 were using the patch, the one in the middle and the one on the right, and the one on the left was not. Let me take you through it. This is before. This is 6 days after. Now look at the woman on the left. It's absolutely fine. By the way, none of this is painful, which is nice. On a scale of 1 to 10, it's like a 1 or 2 out of 10 in terms of pain. But do you see the redness and the yellow in the patient on the left who's not using the patch? And look at the person in the middle and on the right. Now they have a Vaseline on them. They look kind of shiny right now because that helps the cells heal over after we get them to rebuild their skin again. But they look more healed to me. I've been doing this for 25 years. The one on the left is typical. The one in the middle, the one on the right is not typical. That's not what I'm used to seeing. Now I am. But when I first saw it, I thought, this is crazy. So they look to me like patients about 10 days after surgery at 6 days. So let's look just 4 days later. Look at them all at 4 days later. This is 4 days later. This is 10 days after surgery. The one on the left is better healed. She looks better. Okay, there's still a couple areas to heal. Look at the one in the middle and the one on the right. They look like patients about a month after surgery at 10 days after surgery. So we're now recommending this to every patient who comes in. Every patient who comes in, I have them use about a month before, and they're on it for about 6 months after. When I've been doing this, the interesting thing that we're hearing other things. We're hearing back pain going down 80% on a woman who came from Boca up to us. We had a woman who's had gastric reflux for 30 years after having her babies. She's had gastric reflux for 30 years. she's on this for about a month, and her gastric reflux is resolved. We had a patient who came in from Michigan. She said, I met her for the first time. She said, Dr. Knights, nice to meet you. What did you do to me? I said, I just meeting you. I don't know. No, what did you do to me? I've had a tendonitis in my hands for 1.5 years. Look at this. And she starts opening and closing her hands. And so I said, oh, so the stem cells healed that first. And then because she was on the patches, she healed fast from the procedure. It's amazing how we're helping people with their health as well as their body as well. These are the 2 patients at 10 days. It took her 5 weeks to look as good as these people did at 10 days. Amazing.
That is amazing. Hey, real quick question on that.
Yeah.
Doctor, where were these patients placing the X39 patch? Was it back of neck on the?
It doesn't matter. It doesn't matter.
It
really doesn't matter. Okay. They could put it on their toe. It doesn't matter because the stem cells know where to go in the body.
Yeah, that's what I tell people too. Somebody was specifically asking with those. Cool.
So I have a book on Amazon called The True Definition of Beauty. It was a Wall Street Journal bestseller. It's part of the reason I got on Howard Stern, that they read the book and they had me come in to speak to them. If you want to follow me or any questions on Instagram, that's where I am. If you want to hear this webinar again, if you scan that QR code, not this webinar, but another one I gave, but if you want to hear the talk again, you can scan that QR code and then I'll take you to the talk.
Does that take them to the video that I found?
Yeah, please do.
Okay, that's where that good. Cool. Yeah, that's great. Thank you so much for coming on. And I think we just had those couple questions that we already.
Yeah, I'd love to answer questions.
Yeah, so if anybody has any questions, we still have some people on. If you want to ask them in the chat, can this be used in points with renal transplant?
Yeah, it can be used with a renal transplant. Yes, it can. Yes.
Okay.
And with the ice wave, it's interesting. You have to put it on the pain, and then you bounce the other one around until you find the spot. It's kind of amazing how it works. It kind of shuts down the pain. So hopefully that's been helpful to you. There are a lot of patches besides X39, but we really want everyone to start with this first. And my patients are just using X39. That's correct.
When I first started, I was just doing X39 for the first few months, and I was getting all of those benefits from just that. So it really is. It's kind of the foundational patch, is what I like to say. Foundational.
Very much so.
Use that one. Know if X39 can help with nerve issues after facial surgery due to injury.
Yeah, it's interesting. So they were looking initially at diabetic patients who had diabetic neuropathy. And early on, they found if they could somehow, if we could increase copper peptide, if anyone out there knows how we can increase copper peptide, if we could somehow, if with high copper peptide, actually diabetics could get nerve regrowth to their toes and they could feel better. So absolutely, it can be used for someone like that. Yes, we have a lot of people fly in for surgery. So we give them the link on how to get it on their own, but we do carry it through the office too. So if they didn't pick it up ahead of time, they can buy it through the office.
We will just take the opportunity to tell everybody that, get back to the person that invited you to this podcast webinar tonight, and they can answer further questions and also tell you how to give it a shot. 30 days risk-free. Just give it a shot. That's the best thing you can do. It's kind of hard to believe this little thing can do what we're talking about. I'm Iron Man today. I don't ever peel one off when I'm on a call because these are worth too much to me. But you just got to try it and see for yourself. You give it a 90-day shot. 90 days, it's almost impossible not to feel some amazing stuff in the 90 days.
Just drink water while you're on. Drink water while you.
For sure. Hydrate for sure.
Can this help stroke patients? Absolutely. Yeah. Absolutely can help people with that. The best time to use it is, it's interesting. Some patients find that it gives them a lot of energy and they'll wear it, like morning. Other people find that they like to wear it at night. It really doesn't matter. The idea is 12 hours on, 12 hours off, because you don't want to get habituated to the copper peptide levels that get increased. You want to have them rise and let them fall, and then have them rise, because you have more of an effect from the ramp up each day of the copper peptide.
Can the patches help treat or stop the growth of fibroids?
Here's what it does do. If there's inflammation that's causing these issues, it's greatly anti-inflammatory. That's what stem cells do, honestly, too. They go to areas of inflammation. So if in a fibroid that's just quiet, that hasn't done anything, I don't know if it would help, but in one that's growing, it probably would be helpful.
Using the X39 and X39 together, that's my everyday, because I just feel, I feel like 10 years younger, and I've only been doing it for 2 months. So
the X39 is the alanine.
Right.
That's the alanine, yeah.
Yeah.
Would you use Aeon instead of Icewave for pain? If you want more immediate control of pain, now, the Icewave doesn't get rid of the cause of the pain, it just stops the pain. So that you could use that. But the Aeon patch was one of the original ones in terms of long term. It could help with the pain more long term. But if you're trying to immediate pain relief, the Icewave works better.
Well, cool. I think we'll go ahead and wrap the meeting. Thank you so much, Adam, Dr. Adam. Say Dr. Adam, for being here and for sharing this amazing knowledge. And I hope everyone was as blown away as I was when I first saw his presentation. Again, his full presentation's on YouTube, and he has the awesome clips of him on Dr. Oz and stuff. That was fun. Again, my website is bodylightheals.com, and I have in the science and technology and studies section of my website, I have 80 clinical studies that have been published. You can go and read the actual studies. One of them, Dr. Adam talked about tonight on the call. So it really is an amazing technology. And please get back to the person who invited you to this call tonight. They love you very much for inviting you to be here, because we're all trying to just help people have better well-being in their lives. And certainly it's worked for me, which is why I had a total 180 shift in my life, and why I've put my whole weight and influence behind this company. So I love
Awesome.
Lifewave. Thank you, Adam. And we'll go ahead and sign off. Thank you, everybody.
Take care, guys.
Yep. Bye-bye.